rid of the Affordable Care Act and replacing it. Lawmakers on both sides of the aisle preparing for an overnight battle to repeal and replace President Obama's signature legislation. The Club for Growth is backing the Obamacare repeal resolution, saying, quote, Congress still has a lot of work to do in order to end Obamacare and replace it with a market-driven pro-growth health care insurance plan. But passing this resolution is the necessary first step. David McIntosh is the president of the Club for Growth, and he joins us now. Good to see you again, David. So I think there is a plan. There is a replacement plan, and it comes from Senator Rand Paul. He's outlined the details of it. It's very specific that he wants to put money back in the pockets of the consumers of the health care, take it away from both the government and insurers, give it back to the insurers, give it back to the individuals, let them decide how they want to get their health care. What's wrong with that plan?
It's a great plan. It features around the health savings account where individuals and their families have the money that they decide how to pay for the doctors and the procedures they need. It also does something really important. You know, President-elect Trump has said nobody's going to lose their insurance, and Senator Paul's plan takes care of that but he doesn't use the Democratic way of saying we're going to have a regulation that means everybody's insurance premium goes up $4,000, $5,000, becomes unaffordable for a lot of families. Instead, he sets up these risk pools and says if you are high risk, you've got cancer or some other disease that's expensive, we're going to take care of you. You'll have insurance, but we'll set up these high-risk pools, and then the marketplace can take care of everybody else.
But the main thing, and Rand, it's not coincidental that Rand Paul is a doctor. He's a physician himself. He understands the situation. If you put as little distance between the patient and the care provider as possible, get rid of government, get rid of all the insurers that you possibly can, and just have the individual pay for his health care. That individual is going to take more care to make sure he gets the cheapest but best health care possible. That's the bottom line, is it not?
Absolutely. We saw it in Indiana where Governor Daniels and then Governor Pence, now Vice President-elect, used health savings accounts to help people who were on Medicaid, government-paid health care, and state employees. Suddenly you saw advertisements by the hospitals saying, hey, if you come get an MRI with me, it's less expensive, and we've got the highest quality in the state.
Yeah, it's
so the market works.
The market works. It's been shown to work. Laser surgery for the eyes proves that as well. Quick last question, David. Why is it that when Senator Mitch McConnell was asked about Rand Paul's plan last Sunday, he said, well, I haven't talked to Rand about it, I haven't read it, so I can't speak about it? Why doesn't he know about it? It's easy to read. You can find it anywhere. Mitch McConnell, the head of the Senate, should know, should he not?
Well, David, I think there's going to be a new game in town because President-elect Trump has said, look, a few weeks after you confirm my Secretary Price, I want you to get a bill on my desk. So it's not going to be a 2, 3, 4-year bill writing process. And Senator McConnell and the rest of them are going to need to read these great bills like Rand Paul's.
And
Price has one, too, that he worked on in the House.
David is putting their feet to the fire on all this. Thank you very much, David. Appreciate you being here. Appreciate it.